Okay, so welcome to this next video in which we are discussing thrombosis and antithrombotic drugs. Okay, so we've just discussed warfarin, and to summarise warfarin's mechanism again, because it's worth repeating, warfarin, when you take it orally, will go into the cells of the liver. It will inhibit the vitamin K epoxide reductase enzyme in the liver, which will stop the conversion of vitamin K epoxide down here into vitamin K, and also it will stop the conversion of vitamin K into vitamin K hydroquinone. Now, vitamin K hydroquinone is a necessary substrate for the enzyme gamma glutamyl carboxylase, okay? And if you do not have this substrate, if you do not have the vitamin K hydroquinone, then the enzyme gamma glutamyl carboxylase cannot function, because in order for it to function it needs to convert vitamin K hydroquinone into vitamin K epoxide. It couples that reaction to the carboxylation of the R group of glutamic acid. So to make gamma carboxy glutamic acid, you need a way of you need vitamin K hydroquinone. So if you block the regeneration of vitamin K hydroquinone from vitamin K epoxide, then gradually you're going to use up all of your vitamin K hydroquinone, and it's going to accumulate in vitamin K epoxide. Okay? After that, after you're out of vitamin K hydroquinone, then you're not going to be able to synthesize any more gamma glutamyl carboxylase. You're not going to be able to produce any more gamma carboxy glutamic acid residues, okay? And basically you need to convert glutamic acid residues to gamma carboxy glutamic acid residues in order for the proteins coagulation factor 2, coagulation factor 7, coagulation factor 9, and coagulation factor 10 to actually be functional. So what warfarin is going to do is it's going to stop the production of functional coagulation factor 2, coagulation factor 7, coagulation factor 9, and coagulation factor 10. So let me impress on you what this is going to do. So here is the intrinsic coagulation cascade. So warfarin, which we'll have in blue, pink was heparin or antithrombin free. So blue now is warfarin, so it's going to stop the function of thrombin. You're going to have no prothrombin, and therefore you're going to have no thrombin. Okay, so both of these are going to go out. It's also going to stop the production of 10. So 10A and 10 goes, because if 10 goes, 10A certainly goes. 9 is also going to go, so 9's gone, and therefore 9A has also gone. That's it for this intrinsic pathway, but we can see that just by getting rid of them, you are not going to be able to activate coagulation, because thrombin is basically the essential one here. It's the enzyme which converts fibrinogen into fibrin and also 13 into 13A. So if you have no thrombin, you're not going to get coagulation. Okay. In addition, if we look at the intrinsic coagulation cascade here, then it also stops the production of many of the coagulation factors here. So it stops the production of 7, so therefore 7 and 7A go. So you can't have tissue factor activate 7 to 7A. Then you don't have 10 or 10A, so even if you did have 7A, it wouldn't matter, because it's got nothing to act on. And then again, prothrombin goes, and therefore thrombin also goes here. So basically all levels of the intrinsic cascade also are knocked out by warfarin. Okay, so what this means is that you cannot have coagulation occurring within the blood. You're not going to be able to convert fibrinogen into fibrin strands. Now this means that when you form a thrombus, okay, you're not going to be able to form any fibrin meshwork. And without the fibrin meshwork, we know that the platelet aggregate is simply not stable. So you're not going to get a solid mass being formed. So your thrombuses aren't going to form properly. So therefore, well, we don't want them to form. So therefore, you're not going to get thrombus formation. So warfarin is an incredibly powerful drug to stop the formation of thrombi. It's also a very toxic drug, and to show you how toxic it's used as a rat poison. Okay, so it's used on rat bait. Okay, and the rats eat a huge dose of this warfarin, and basically what it does is it stops the blood from being able to undergo haemostasis. Basically, it stops viable hemostatic plugs being formed, and what happens is that they get huge internal bleeding, basically, because what's happening in the microvasculature, all the time you're getting holes in the side of your blood vessels, so damage to the sides of the blood vessels is occurring all the time, and you need hemostatic plugs to be formed to to plug in these holes, basically. And if you give a rat a large enough dose of warfarin, then you're going to stop the blood from being able to hemostase completely, okay? So they'll bleed to death, basically. Okay, so it's a dangerous drug, but given in the right dose, it can be very effective anti-thrombotic. Okay, right, so two final anticoagulative drugs that I want to discuss. The first is a drug known as dabigatran, okay, so or dabigatran rather. Okay, so dabigatran. Okay, so dabigatran is a drug which is capable of inhibiting thrombin, so it's a direct thrombin inhibitor. So, if in your blood prothrombin or factor 2 is activated to thrombin or factor 2A, then if you're taking this drug dabigatran, it will bind to the thrombin and directly inhibit it. Now, thrombin is the enzyme, remember, which is responsible for converting fibrinogen into fibrin, okay, and then the fibrin strands are assembled into the fibrin monomers are assembled into fibrin strands by 13A, which is also activated by thrombin. So inhibiting thrombin stops coagulation, basically. Okay, then a final drug, a final anticoagulative, is a drug known as rivaroxaban. And this inhibits factor 10A, basically. Okay, so let me show you these on the coagulation cascades.